Hi, I'm Dr. Anoop Dhamangaonkar, practicing joint replacement, joint preservation and orthopedic surgeon. Now we'll talk about a very important topic which most patients go through sometime during their active working life, and that's about knee pain and meniscal injuries. Recently I had a patient, a tech-savvy, AI-influenced patient from the working class, young into his 40s, who came into the OPD saying that, Doc, I have this knee pain. I think I've torn my meniscus. It could be even an arthritis. I need surgery. I am having sleepless nights in the past 3 weeks. Well, what he said was, it just started by merely a step that he took off while climbing out of his bus, and suddenly he had got some clicking sound in his knee, which initially he ignored 3 months back. Then it gradually progressed to having some kind of pain, then some stiffness, and now he says that he can't even stand and walk for a longer distance, even half a kilometer. Going to the market is a problem when he perceives that pain. So I told him about what the meniscus is actually. So meniscus is not barely a pillow below your neck. It's working more than what we expect our pillows to do. So it's definitely like a cushion in your knee. Take the impact, absorb the impact, and protect the knee from abnormal forces. So whenever we are having a kind of an axial loading on the knee, knees is cartilage, which is the covering over the knees, is protected because of the meniscus, which absorbs this kind of axial impact or any rotational impact. Now, whenever we have any kind of deep flexion activity or any rotational activity, especially on knees which do not have any strong muscles around them, that can lead to a meniscal injury. Now, how do meniscal injuries normally present? They would present as a dull aching pain, especially on the inner side in most patients. They would present as some amount of swelling that comes up when you walk for a long time, and of course some kind of catching pain, sharp shooting pain when you're deeply flexing the knee, as in squats, lunges, etc., or whenever you're doing any impact activities. Some patients also believe that the knee appears to be locked in meniscal injuries, and that is a time when you need not wait at home, take home remedies. I don't think that's something advisable. You need to take an opinion of a nearest orthopedic surgeon. So what do we do when you're diagnosed of a meniscal injury? I think you should be very, very hopeful of a treatment that every knee injury or meniscal injury does not require surgery. I think it's important to get consultation early. You can prevent a surgery by doing appropriate exercises, avoiding a few activities, and definitely, applying ice, some nursing care that you need to do at the time of the injury. Okay, so these are some things that you will really do to avoid a surgery. Well, if these actually fail, then of course we have got elegant keyhole surgeries by which we can fix your meniscus in most cases and get you back to your sporting best.